Okay, can I thank you all for coming back, and I thank you for this afternoon. I think we've had a great day. We've had 3 ministers, 2 cabinet ministers. We've had the DG, Director General for Local Government. We've had all of you, chief executives, chief officers, chief executive chairs, and leaders, and it's been a real privilege to have today. We are at that point on the cusp of moving into the new integration landscape. It's the 30th of March. We're 2 days away from go live for some lucky partnerships in the Ayrshires at this stage, and we're really quite excited about that. I was going to reflect on maybe a few of the highlights which I took out of today. And for those of you who follow me on Twitter, you'll have seen some of them. Twitter is actually quite a good way of making your notes as you go along during the day. So first of all, we had Sarah Davidson, who began with the focus on people. And throughout the day, we've seen the films which are intended to take it back to what the purpose of integration is about. What I do need to clarify is that Sarah Davidson is not a 97-year-old woman, and there was some concern that the picture that I'd associated with it suggested it was in fact Sarah Davidson, but that is not Sarah Davidson, if you're following on the Twitter feed. But it began in the right way. John Swinney, a number of things from his presentation. Health and social care integration described as a mega reform, described as the biggest reform that we're currently engaged in. And I think he was doing that to put all of our minds into the place of the scale of the endeavour that we're engaged in. This is about what all of this government is about in terms of taking forward change in health and social care outcomes for people. He used the terms partnership, leadership, and engagement, and focused on what that would mean for this group, this leadership cohort, in taking the agenda forward. At the end of the session, he did a vox pop for the video for the show reel that we're going to do, and I hope some of you have done that as well. And he described it as a once-in-a-generation reform, which was challenging and offered an opportunity that would not be, this was the opportunity to take this forward. So clearly, really motivated, really engaged, but also very challenging for all of us in that space. He said, my objective is in 5 years, Scotland is known for person-centred care. So that would be how we're regarded. At the moment, I spend quite a lot of my time reading Nuffield and King's Fund reports, and they describe the best systems in the world that do integration care. And Scotland sometimes gets a bit of a mention, but I'd like in 5 years' time that when they write their reports, that they're writing the reports about what you're doing on the ground in localities. That's what the scale of our ambition here needs to be. Peter Johnson described this as a revolution, as something which was upsetting the old order that was going to be transformational, and set it in that space. Again, a scale of ambition which goes beyond the normal. Leslie Maclay, she talked in terms of, with the great work that's been going on in Tayside, but one of the thing which I took from that was the idea of show me, don't tell me. If you want to bring communities with you as part of this journey, you need to be able to demonstrate. Bernadette Malone asked the very interesting question, where did you sleep last night? This question, looking for 98% of people sleeping at home in their own accommodation, not in a care home, not in a hospital, not in some other form of accommodation, and trying to get into that space. And it was interesting because that generated a wee bit of Twitter interplay just about how good our data was to support that. And a lot of these presentations heavy on data. Iona Colvin talked about the need for building teams around primary care. Again, thinking, asking people, and she talked about how going into a process and focusing on something like mental health and thinking it was important, but coming out knowing it was even more important to the community than officials had thought. Marco Biaggi, participant engagement, not just a process, a public health measure. And he quoted Harry Burns in that space. So something that didn't just do something for how we took the business forward, but actually gave people meaning and a sense of control. So tapping into the things which motivate us. And the thing which I tweeted today, which got the most retweets, was the era of telling people what to do is long gone. We're in a new era of listening to people and working together. And that was retweeted across the room and beyond the room. So that sense of working to support people and with people was foundational. We had a bit of a discussion about avant-garde jazz, which I'm really not sure what that is, but I understand that Gary Coots is available and has an extensive knowledge of the subject. Sir Peter Housden was, I think, very candid in his reflections as a leader in the processes which he's had to go through. And I've had a couple of sessions with him in the last couple of weeks where he's talked about this event. So he didn't come here today having picked up some papers over the weekend, which he then delivered to you. He thought clearly about what change we were going through, what was required, and particularly his interest in this room. It's in all of you, but it's particularly in the chief officers in this new pivotal role which has to take forward the reform. And he is keen, and we've arranged already for him to follow up with the chief officers in June to talk about their reflections on the day, but on their process, and also how we can continue to work with that group. And that's a real opportunity. I think there's a real need for us to continue to invest in the chief officers who are going to be the key agents of change in all of this. A few things from what Sir Peter said. So be clear about your personal narrative. What are you about? And whether you exemplify that. Keep centered on purpose with a vision for where you're going. So don't be blown around by all the noise in the system, and the health and social care system can be quite noisy, but come back to what we're about. He also gave the quite challenging message, don't leave untended what needs addressed. Quite often it can be easy to tolerate behaviours and attitudes that need addressed, but there's an endeavour here which we have to take forward. Finally, don't talk down your own contribution. I guess that's his reflection on the Scots. As a non-Scot myself, I can also see this reluctance to take credit for the leadership which you're already giving to the programme, but he's asking you to be clear in understanding your own contribution. Shona Robeson talked about integration being about bringing together services and people to improve the whole pathway of care. But more strongly, what she said was, I want every partnership to be bold and ambitious, and ask the question, why not at home? She talked about the 2% and the 50% and how we use resources in the system. And again, not with an answer to that, but with a challenge to that as to whether that's the right distribution of resources. And also looking to new ways of working through primary care. And that was quite a theme throughout the day, how this gave opportunities to maybe rethink how we work with the contract, but also how we work with communities and how primary care would be central to that. As I've said, we also had the videos throughout the day, bringing it back to the experience of people receiving, offering, and supporting people in communities. And they were deliberately chosen to begin to bring the focus onto adult services. When we began this work in 2011, we talked about it as work in respect of older people. I think as time has gone on, we've increasingly seen that it's as much about the adult population as it is about the older people population. So for today, we deliberately focused on generally adult stories. The one thing, of course, which I will take from that is I'm going to be very concerned that Margaret will be on my interview panel at some point in the future, and that I'll have to explain what I do to a completely different sort of person. I'm not entirely sure it's going to be competence-based interviewing or capability-based interviewing, but I'll be looking forward to that. So that's what I took for the day, from the day. I was also quite keen to thank Kathleen Bessos, but I think she may have gone. I'm not sure. Is Kathleen? Kathleen, sorry. I just wanted to thank you from all of us on the team. Bernadette thanked you this morning, but we wouldn't be here without the work you've done. So thank you, Kathleen. So those are my reflections on the day. I just want to close by saying we see this as the beginning of a process, working particularly with the chief officers, but looking for the opportunity to bring a wider group of people together regularly. When we did the evidence work in terms of what you needed to have in place to take forward integration, we took 4 key messages out of that. First of all, there was a need to plan for populations, not for organizations or systems. So to think about what the outcomes you're after. Secondly, a need to be able to work with resources on a pooled basis, both people and money, and a lot of that's come out of the discussions in terms of also what people are asking for from services. Thirdly, the need to embed clinicians throughout the process, both in planning, resource allocation, but also in the commissioning process. So clinicians need to be right through the process, working together, taking forward the change, not just advising. But finally, the fourth element was a need for strong leadership based on a focus on outcomes, and that's why we brought today together. This was a point in time when there was an opportunity to basically mark out the territory for the next period of time. Mr. Swinney talked about the next 5 years, and that was the period in which he was looking at. Others have talked about that as a period of time in which we would expect to see significant change, so there's a real challenge there. But the sense I've got from today's discussions is that people are up for it. So I would just like to say again, thank you. Thank you for being here today, and thank you for working with us on this agenda.